There we go. So, thank you for joining us for our second session of our caregiver training and support seminars funded by the Hussman Foundation. Today, Karen Scollin with Special Needs Parents and Support Services of Louisiana will be presenting to us today and sharing her great knowledge about navigating government services for individuals with disabilities. Directly after Karen's presentation, I will be doing a short overview of our Autism Society materials that are designed to help guide you in selecting high quality providers that work for your family. So Karen, are you ready to get started?
I sure am. Thank you, Claire.
Okay, would
Okay.
you like me to skip to the next slide?
Yes, please. Hi, everyone. So today, as Claire said, we're talking about navigating government services for people with disabilities. Again, as Claire said, my name is Karen Scallon. I am the owner, operator, and advocate for my agency, Special Needs and Parent Support Services of Louisiana. You can reach me at my helpline email or messenger on Facebook through my business app. You can see there in blue, both those in blue. I also do have a helpline, although right now the quickest way to get me is through the email because I have so many calls coming through on the helpline that it can get backed up a little bit. I also have some good information on Pinterest and on my website if you're interested in looking at that. I do try to keep the website as up to date as possible, and I'm due for another update soon. I'll report on things that are changes with Medicaid, things like open enrollment information, self-directed Medicaid waiver services, and things like that. So you may want to take a look at that website. Okay, we can go to the next slide, Claire. So when you first get a diagnosis for your child, and you may have struggled to get that, you're launched into this whole other world with all these programs. Some of them are state, some are federal, some are hybrid, some are private. You've got all these Healthy Louisiana plans you can choose if you're on Medicaid. But then there's all these other things that can also supplement different care needs that your child has. It is a very, very complex system to navigate both government and private services that are out there. We can go to the next slide. So when that does happen, then you're launched into the acronyms, and you're not just in a different land, you're learning an entire new language. It is a very daunting process. Let's go to the next slide. So all of these programs can be complicated. But the most, I would say, in my estimation, in navigating the most complicated to me is the Medicaid process. So I'm going to focus heavily on that this morning and or this afternoon and talk about that a little bit and how to navigate those things. I can tell you guys, I've been doing this. My son's going to be 24 next year, almost 20 years, and in a variety of different capacities. And every single day, I learn something new. So I would like everybody to know going into this, it is a real complicated system with a lot of moving parts, and it covers a lot of different types of people. But I don't want anybody to feel like they should, oh, I should be getting this. Oh, why can't I understand all of this? You can't understand it for good reason. It's very complicated. And I haven't met a person yet that can just, you know, jump right in and say, okay, I got all of it. It's going to take, repetition and working through the system to learn kind of some of these ropes, and then relying on people like Claire, myself, other people in the community that are leaders, whether it's with your Human Service District Authority, the Department of Health, to help you. And so don't be afraid to ask questions. Like I said, very complicated, lots of information. Let's go to the next slide. So I like to use the analogy of accessing Medicaid to there's a whole bunch of different doors that get you in the room to get services. A lot of times people say, Oh, well, I applied for this Medicaid program but I don't know what it covers. I don't know what it has. I don't know what it gives me. Um, for all intent and purposes, for the most part, most of the programs that you're going to encounter or things that you hear about as a program, they're really just a door to get a set of services. Okay. So let's go to the next slide. So these doors depend on your situation or your child's situation. Door one, if your child gets supplemental security income from Social Security, your child is automatically going to be turned on in the system for Medicaid. Social Security can do that. It'll go to the state. They already see it. You don't have to fill out an application. You're going to start getting stuff in the mail, and it's going to say your child has Medicaid. That's really good. But the downside of that is if you are deemed no longer eligible for that check from Social Security, it automatically turns off your child's Medicaid. So you have to go back and apply again and see if you fit into any other door. Same thing for program. It's what they call WellNet. If you suddenly are cut off from that, it cuts off the Medicaid too. You got to go back, reapply, see if you can get through in another door. All right, let's go to the next slide.
I advanced at care, and I think that the
Claire, did we?
Wi-Fi is a little bit slow today.
Yeah,
There it
there it
goes.
is. Yeah, that's okay. That's okay. So the next door is what we call Medicaid expansion. You may recall that that was implemented in Louisiana. Um, it is for adults who are at no higher than 138% of federal poverty level. And it's all the regular Medicaid services. This is one more access for them to be able to get it. You have to be 19 or over. Now, a little caveat about programs like this. So when you see something is based on federal poverty levels can change. They don't always. I've seen a couple of years where they stayed the same, but for the most part, they're going to change on April 1st of any given year. So if you are an individual, let's say, as example of this program, I am a single individual and I'm applying for the Medicaid expansion opportunity to get Medicaid, and I am making $1,775 a month. That puts me over the limit to be able to get the Medicaid expansion. So my best advice, if the next step is to go to the marketplace and see if you can get a plan, but check for Medicaid next year because that can be the difference, that few dollars. If I'm making the same amount of money next year, if the poverty levels have shifted up, then I very well may be eligible for Medicaid. All right, let's go to the next slide. And I'm just going to wait till it comes up, Claire, if that's all right with everybody. Okay. So the next door is LaChip. Y'all may have heard of this. This is Louisiana Children's Health Insurance Program. Every state has a CHIP program. This is to get children who have no insurance at all insured because we know that that keeps them healthy. If they're healthy, they stay in school. If they stay in school, they have better outcomes. This is for children under 19 who have absolutely no insurance. And families can have an allowable income up to 200% of federal poverty level. And you get your services through that Healthy Louisiana network. Let's go to the next plan. The next page. Now, the next one is the CHIP Affordable Plan. They realize that there's some children that could go in and out of private insurance as the parents' employment changed. We do have some people that do the type of work that sometimes it's seasonal, sometimes, they get laid off at a certain point of the year. They may be eligible and then not eligible. So this is for children who are without insurance for 3 months. They have to be under 19 and the family can be at 250% of federal poverty level, but there is a little premium on this. It's $50 a month. That's the insurance premium, and they pay that into the there's a location where they pay it to the state Office of Group Benefits. Excuse me. Let's go to the next slide. Now, this one is new, and this one is the one I think that a lot of people may be interested in. If you haven't heard about it before, it's called TEFRA or Act 421 Medicaid. It's for children with disabilities in Louisiana. And some of the criteria is you have to be a Louisiana resident, under 19. You have to meet the definition of a child with a disability under Social Security law. Now, you do not have to be eligible to get a check, but it is the same criteria as if you had low income and went in and applied for a check for your child that has a disability. So they're going to look at that definition versus against whatever documentation is supplied to support your child's diagnosis. Now, the child has to have countable resources equal or less than the resource limits, blah, 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 blah. What that basically means is the parental income is not counted. The child's income is counted. But you will find that if you apply for this program, you're going to have to submit all of your income information anyway. And the reason for that is in order to be reviewed for TEFRA eligibility, the first thing is they have to be sure you're not eligible under some other Medicaid program, CHIP Affordable, or anything like that. So they're going to review that income information and say, okay, they don't meet any of that criteria, and the child has a disability. So now we're going to go to the TEFRA criteria. So the first thing they're going to do is send you a packet of stuff. You're going to fill it out. You're going to get medical release forms. And then you will see on the right-hand side, after you have to be a U.S. citizen or qualified non-citizen, you have to also meet a level of care. Now, there's three different levels of care for this program. Um, it can be the level of care must meet the threshold of someone who could go into a nursing home, or could be hospitalized, or it could be someone who's qualified to get developmental disability services or be in institutional care. That's what ICFIDD is. It means Intermediate Care Facility for Intellectual and Developmental Disabilities. Um, so there's one of those three levels of care have to be met. And there's a nurse that calls you and they talk to you to see, after looking at your paperwork, to see which level of care is the appropriate one for your child. There's a couple of hoops that you have to jump through for developmental disability. You will have to, if you have not already applied for developmental disability services, they're going to put you through that process and see if you get that letter of approval. And then once they have that, and there's a nursing criteria that she asks you questions, and a hospital criteria. I didn't mean to leave that out, depending on which one is most appropriate. So you have to have one of those levels of care met and meet the definition of a child with a disability under Social Security law. So it can take quite a while. It can take several months. So I went through, if we could move to the next slide, Claire, there is a chart, and you're going to see the link coming up on the next slide, an informational flyer, and then there's an application process chart. If you sit and go through it and count the days that are minimum and maximum, they'll give you a range of days, so many days to do this, so many to do that. The process takes a minimum of 90 days. And I see a max on the Department of Health side of 107 days. Now, that doesn't include any time frame it takes for you to return documents, for them to, put them through their process, do everything that they have to do. It doesn't take into fact some of that time. So it could be a 4-month process. Now, in addition to that, it doesn't take into account the processing time for that Social Security definition determination. And that can be quite a lengthy hang up, especially if the documentation is kind of gray, it doesn't really jump out and say the child meets the definition, or the other time I find that can cause some delays is if the analyst that has the application um, has a hard time getting your doctor to send information in. I strongly encourage you to send in any information and documentation that you have. If you had private testing done, and you have copies of those reports. School educational evaluations are accepted. The IEP, especially if there's a IEP with a behavior plan and a health plan with, and all of that can be sent in for consideration by the team that does that determination. Those can all be uploaded, and you'll see later on where that all kind of goes. You can send it in. Now, I always encourage just my little tidbits here and there. Um, I always encourage you that if you're going to send something to Medicaid or any state entity, local government agency, make a copy for yourself, make note of when you sent it, make note of how you sent it. If you can send it electronically, do so because you have proof there. And those things can be very important if paperwork is lost. So just a little kind of housekeeping thing. So let's go to the next slide. So this is what we had before we had TEFRA, and we do still have it. Family Opportunity Act Medicaid. It's been around for quite a while. I remember when the state first had this, I was on the team that gave, commentary and feedback on the program. You have to be under 18, under 19. You have to also meet that Social Security definition of a child with a disability. But the difference here is you do not have to meet that level of care definition. You can, but it does count the family income. So it's about 300% of federal poverty level, roughly. There is a premium, and I don't know how they determine the premium. Most people I know are getting about a premium of about $35 a month. I've heard of even lower than that. Um, but one good thing is if you have more than one child, like so many families do that have a disability, and they both qualify, you only pay one premium. You're not going to be paying for each kid. And this gives you access to Medicaid as well. So if you go through all of that determination, they see you make too much money or you're not eligible for anything, they go look at TEFRA, and the nurse comes back and says, well, your child doesn't meet the criteria for the level of care, so you're not eligible for TEFRA. Then they can go back and look at Family Opportunity Act Medicaid. So they put this one last because of the fact that there is a premium for this, whereas TEFRA, there isn't. So we want to review families for what's going to be most financially beneficial to them to begin with, and that's going to be TEFRA. So let's go to the next slide. Now, the next door are developmental disability waivers. We're going to get in more into waivers as we go through. But just know that for a waiver through Office of Citizens with Developmental Disabilities, our DD waiver system, you have to have first a statement of approval from your Human Service Authority or district. The recipient's income is what's counted. But there is a little caveat, and I'll mention this again when we talk more about waivers, but only the individual's income is counted except for the first 30 days of a children's choice waiver. Now, there's lots of reasons for that, but mainly it links back to if your child is in the hospital for 30 days, on day 31, you're eligible for Social Security and Medicaid. So that first 30 days it's on the family's income. After that, and I'll tell you some more about it when we get to that, but after that, it's only based on the child's income. Now, you can have your health care, and this is an optional thing for people with waivers, that you can have your health care not in those managed care organizations. Okay, so it's like 6 of them now. It's so much to sift through. You can have it in what we call legacy Medicaid or old fee for service Medicaid system. And you can go in and out of that just for your health care. You can move in, you can move out. You just always want to make sure that your doctors are covered under both, that you know what day it's switching over, that you let your therapists know, because there is some, little quirky things about prior authorizations you have to know when you're moving those things around. Your behavioral health and your transportation stay with your Healthy Louisiana plan. And the big thing is it provides an extra packet of services over and above what you get with just Medicaid. There are no premiums for this. And we're going to talk about that extra packet of services some more. So let's go to the next slide. So this is a behavioral health waiver. Uh, it is set up for roughly about 2,400 slots statewide, divided among the regions. So it's not a tremendous number of kids in the grand scheme of things, but it is very beneficial when it works and when a child can access it. It's for children between 5 and 20 who have a behavioral health diagnosis or a co-occurring disorder, and autism is specifically in the language as a qualifying co-occurring disorder. So it's really important that that's in there. It's for children who have a history with either child welfare, juvenile justice, trouble at school, or they're in danger of being in out of home or out of school placement, out of home. Maybe they're going to foster care. Maybe they're going on probation. Maybe the school is threatened alternative school. But it provides for additional services over and above the state services that we'll be talking about in a minute. There are no premiums for this, and I'll tell you all how to access this as we get to that part. So let's go to the next slide. Now, door number 10. These are certain other individuals getting certain services depending. Children in foster care can receive Medicaid. Children receiving adoption assistance can receive Medicaid. Now, this is not the little deal like with Social Security where they can just switch it on and switch it off. I'm sure there's application process to go in this, but given, I think it was somewhere in when you go through the application, there's a question in there about that. So you can make that known, and then they provide the access to the services for the child. Now, some individuals who have breast and cervical cancer and need breast and cervical cancer treatment, um, it's it's a little unclear to me, but I've known some of these people who have this access Medicaid this way, but they aren't giving the full array of services, and I don't really know what the criteria is for that. So I'm going to straight up tell you it's not my area. But if someone needs that, I will be more than happy to direct or help look that up, that information up, because it's just kind of a really small niche of people. Let's go to the next slide. So this one is for adults who get disabilities. Now, when we talk about a developmental disability has to have occurred before the age of 22. Um, for the Office of Aging and Adult Services, their waivers for adult and elderly individuals, you have to be 22 or older, be disabled 22 or older. And that fits things like, if you're in a car accident, if you have dementia, if there's, maybe some other long-term medical disease that occurred and is debilitating. So that's the difference between those two departments. Now they have two waivers. They have a community choices waiver, which is kind of like our developmental disability waivers. It provides some in-home services. And then they have something called Adult Day Health Center waiver. And I like to mention this no matter what group I'm presenting to, because these two programs, particularly that Adult Day Health Center, can be very beneficial. There is DayHab built into developmental disability waivers. This is for the person I call caregivers like this kind of the sandwich generation where, and I was in this myself, I was caring for my son who has Down syndrome and autism, and my husband who had dementia, and then my father and mother, who my father had dementia, and my mother has a mobility disability. So it was very difficult to be able to work. And the Adult Day Health Center is it was a godsend. So my husband was able to go to the center for the day, I brought him before work. I picked him up after work. And while he was there, he had a lot of help monitoring his blood sugar levels for diabetes and checking other things. They usually have nurses on staff. I think they're required to have two nurses. Um, the nurses will do blood sugar tests, they'll do well checks, they'll give you the family, like if they, check their feet if they're diabetic and that kind of thing, they'll give the family suggestions on to follow what to follow up with the doctor. So if for any of you out there who are in that kind of a sandwich situation, caring for elderly parents or anything, this is a really important program. Both of these are. Um, Additionally, they have long-term personal care services. Now, you cannot get the long-term personal care services and one of the waivers. But you can get long-term personal care services if you already qualify for Medicaid. Now, talking about community choices waiver and adult day health center waiver, the application kind of works like it does with developmental disabilities. You apply and then you're told, yes, you meet the qualification and you get your packet of services, your extra packet of services. There's also something called PACE, which is uh more like it reminds me of just what we had when our son was in early intervention. It's a wraparound type thing with lots of services to kind of piece together all these programs for you to help someone who's elderly. It is only available in certain areas like Greater New Orleans area, Lafayette area. There has to be a certain number of types of providers that can participate in it. So it's not really available widespread, but it's very beneficial if you need that. There's no premiums involved, and these services are provided in addition to the state plan services, except for in the case of the long-term personal care service. Let's go to the next slide. So once you get the door locked, what's behind the door? Let's go to the next slide. This is the big question. You're like, what am I gonna receive? What's gonna be covered? So let's just talk about that. I keep saying state plan services or regular Medicaid services. If you access Medicaid through any of these doors, one and two, three, four, five through seven and 10, that's because you have SSI or FITAP welfare, the expansion, the LECHIP programs, the TEFRA or FOIA, Family Opportunity Act, just disability programs, foster adoptive care, and even some with breast and cervical cancer, you're going to get what's called state plan covered services. It is a single block of services, and it is what the state has submitted to Medicaid as, hey, this is what our state wants to provide. Let's go to the next slide. And that's what's been approved by Medicaid for us to be in our basic plan. So that what it covers are things like doctor visits in hospital, prescriptions, shots, immunizations, lab work, tests, and x-rays, anything mental health, including testing and therapy, your PTOT and speech, applied behavior analysis or ABA services, which I know a lot of people with children with autism particularly, but Down syndrome as well, utilize those ABA services. And then for children, nursing services. Now, children are also going to receive dental and vision services. Adults only, and I have an asterisk by this because there is a little caveat on that. Adults only receive denture services unless they have a developmental disability waiver. So if you have that developmental disability waiver and you're getting those waiver services, then you can also access the full comprehensive dental package. Now, some of the little plans, you get where you got to sign up for the plan. I'm going to get Aetna or AmeriHealth Caritas or Humana or whatever they are. When you sign up for those, they have all kinds of little perks. And there's a comparison chart. You can see what little perks you might get with them. Some of them, not all of them now, but some of them have funding there for dental care for adults, but it'll be just like a value of roughly $500, cleanings and checkups, that kind of thing. It's not going to be anything major or anything like that. And so let's go to the next slide. Okay, so caveat, this slide is incorrect. So I picked it up right before we went live, and I let Claire know I'm going to send a new set of the slides to her so she can distribute them to you all. So I got I actually had some information from long-term personal care service in here, and it's wrong. So let's just say what's correct. EPSDT personal care service. This is just like long-term personal care service, except it's for children, but you can use this service when you have a waiver, if it's a developmental disability waiver. So like children who have the Children's Choice waiver can receive both the personal care service and it says family supports, that's the waiver. They can get both personal care service and the waiver on the same day. The way it works is you have a little kind of eval to see what's needed. Let's say you're approved for 2 hours a day of EPSDT personal care service. So you have a worker coming from the personal care service agency. That's not a service that can be self-directed. So you have a worker coming, they work those first 2 hours under EPSDT personal care service state plan service. Then they clock out and clock back in under your waiver service. And then whatever hours they work that day from there on are under your waiver. Now, the EPSDT personal care service is 7 days a week. So you can have somebody 7 days a week, but you can't accumulate services. So you can't say, well, I'm only going to use it on Saturday and Sunday. If that's the case, you still only get 2 hours on Saturday or Sunday. But it covers things like care, basic care, toileting, hygiene, grooming, um, brushing their teeth, combing their hair, bladder, bowel requirements, assistance with eating, light food prep. They can do some incidental things, but only cleaning wise, but only for the recipient. They're not going to do laundry unless, like, the recipient threw up or soiled their laundry. They'll do that. But if not while they're there, if it didn't happen while they're there, then they're not going to be doing that. They can go with you to take your child to the doctor, but they cannot drive them and they cannot do any medical tasks. Okay. And let's go to the next slide. So this is a link that you can use to access the overarching list. It's a long chart. It gives you a lot of really good information in there about what services the state has just designated that they will cover. Now, all of the Healthy Louisiana plans that you will encounter and Legacy Medicaid, they are all required to provide these services. But within that requirement, there are considerations for medical necessity and making sure that some services are prior authorized. So just bear that in mind. Your prescription drug list is now the same for every one of the plans and Legacy Medicaid. It's one list of preferred drugs. So you can take a look at that, see if a medication is covered. Now, what that list doesn't tell you is that there are some caveats for extreme situations where a child may need a medication that isn't specifically on the list. There are some overrides. There is an override for children because there's a rule that children, the limit is 4 medications a month. But all the doctor has to do is write on the script, um, um, over 4 prescriptions, medical necessity, and there's an override. The pharmacy puts it in, and you don't even see it. Like it shouldn't even be seen. I do have occasion where some new pharmacists will not know that. And they'll tell the parent, well, it was denied because you're over the number of prescriptions you can have for this month, and like you have a medically complex kid that needs all kinds of things. That's just a lack of knowledge on the pharmacist part, and sometimes we have to get in there and do some advocacy to educate them. We can go to the next slide. So how do you apply for Medicaid? So this screen is where you can put in any application for the actual Medicaid portion. Um, if you're going to apply straight up, you can go here. If you're going to apply for TEFRA, Family Opportunity Act Medicaid, you go here. You want to be sure you're on the public tab. As you can see, it's clicked in this screen grab. And then if you notice in the upper right, it says log in and create an account. You will have to create an account, and there's a little video in there that you can watch. I really do suggest you watch it, and it'll tell you what kind of credentials you're going to have to establish because there's multiple things. It's not just because it's all HIPAA protected information, so it have to be more than the regular just a login name and password that you establish. You're going to have to establish some additional credentials. So take a look at that if you're going to apply there. Now let's go to the next slide. Oh, and let me just say this too. If you are in that system, the one of the big benefits of it is you can scan and upload documents directly to them. So there's no question about whether they got it or not. So that's a really good. Um, this is the link to get to that page. Anyone who thinks they might be eligible, their child might be eligible, should apply. Each door to access Medicaid should be explored for you by the analyst that receives your application. It does help to understand these different things, though. One of the big important caveats that I always tell people is if you have a child with a disability and you feel like, I might not meet the other criteria, I think we might wind up in the TEFRA Act 421 Medicaid. Be sure to check off next to your child's name that when it prompts you, does anyone in the family have a disability? Be sure and check that child's name because that is what's going to route that application over to the TEFRA analysts so they can handle it as opposed to the quote unquote regular Medicaid analysts. Um, TEFRA, Medicaid, um, TEFRA, and the developmental disability waivers, the elderly waivers, and nursing homes, all of that is handled by a completely separate department because all of that income levels and all of that and the benefits that you get is all determined by Social Security law. So they are highly more specialized than the people who, not to put anything against them, but the people who do the regular quote unquote Medicaid applications. So that little check, make sure it's going to the right section, which is called long-term care section. Let's go to the next slide. So what do you get? We talked about what you get for the typical door access, right? What do you get for developmental disability waivers, the mental health, behavioral health waiver, and elderly waivers? Let's go to the next slide. Um, all the difference is when you get a waiver, you're going to get all of that regular Medicaid service that everybody else in the state gets, plus an extra packet of services, depending on what the waiver is that you have. So there's a fact sheet for every single waiver that the state has and it will tell you all of the services or potential services that you can get if you need it. Now, I mean, they're not going to give you services that you don't need, but anytime you would need it, if you had that waiver, you can go and say, "Hey, I need day habilitation for my child," or "I need, whatever it may be." So the only difference is an extra packet of services on those waivers because a waiver is just what we said. It waives the regular Medicaid rules. So it either offers you another door to access the Medicaid healthcare services or gives you an extra services over and above the state plan or both. And in the case of the waivers that we're talking about, it's going to do both. Let's go to the next slide. So this is just a summary. The difference, regular Medicaid recipients receive those state plan covered services. Waiver recipients receive state plan plus that extra package. And you're waiving, because you're waiving the regular Medicaid rules. Let's go to the next slide. Now, these are the waivers, just an overview again of the waivers, all the waivers we have in Louisiana. So a developmental disability waiver, we have children's choice for children under the age of 20. So they adjusted this because at 21, all the other services that are out there kind of that's kind of the age that it changes at. So they moved it. Now you go through age 20, and I think at age 20 they start the transition to an adult waiver. Then there's the three adult waivers for developmental disabilities, that is supports waiver, residential options waiver, and the new opportunities waiver. And I've already spent a couple of minutes talking about aging and adult services waiver. That's community choices and ADHD or adult day health center waivers, and the behavioral health coordinated system of care. I want to focus a little bit on these developmental disability waivers here because there are a few little caveats that I would like parents to know. First of all, on that children's choice waiver, you heard me say earlier that when you go in, there's a process, but one part of the process is to complete a long-term care Medicaid application if you're going to get a waiver. So that puts you into that long-term care group officially. Um, for the children's choice waiver, when you go to do your long-term care application, if you do it in the online system, you have to give all of your information, the family information, income, all of that. The system doesn't have any caveats for leaving any of that out. And even though we know after the first 30 days of services, it's based just on the child's income. One thing that you can do is you can use a printed application for long-term care. It's a special application. It's not like you have to make sure you have the long-term care Medicaid application. And I can give anybody who needs that link. When you fill it out, if you fill it out with only your child's financials, you will fill out the demographics and only put your child's financials on there. Then you put in the back, you can opt to waive the first 30 days of services. And I can tell you that the first 30 days of services are going to, because it starts with your date of application, they're going to be eaten up in this whole application process. So it's really going to be neither here nor there. Um, if you want to do that, that is available to you, but you can't do it in the online system or on the phone because when you call in on the phone to apply, they use the same online system. Now, supports waiver and residential options waiver and new opportunities waiver. When you're transitioning from a children's choice waiver into an adult waiver, the process is supposed to be that the support coordinator is working with the family and the individual to determine what their desires are for their future, their life, and to what their support needs are. Based on that, in that process, it can be determined because we have a tiered system now where, yeah, supports waiver only offers maybe, I don't know, 10, 20 hours of support. My child is more involved and needs constant prompting and supervision. Um, he really needs or she really needs a residential options waiver or an additional services, more hours. In that process, the support coordinator can bump the child up to a residential options waiver and write the justification and all the paperwork. You may see some paperwork that still says supports waiver on it, only because they have to enter the system at supports waiver and then put the documentation in for their supervisor to say, yeah, this is an appropriate bump up to residential options waiver. Um, but if you have questions about that or you're worried that your child's going to be stuck in a supports waiver and it's not going to be enough, um, by all means, talk to your support coordinator. If they don't know, talk to their supervisor. And you can call me or you can always call your human service district's developmental disabilities director. They will help you. I've never met one that wasn't, you know, able to help explain kind of what's going on in the paperwork, because it can be a lot of papers. You're going to kill a lot of trees with this. Now, because we have a tiered system, and let's say you get a residential options waiver and maybe you get, I don't know, 80 hours a week, maybe that's not enough for your child. Maybe the child is really a 24-hour care person. In order to make that jump from residential options to new opportunities waiver, there has to be significant documentation, evidence showing that, that extra level or some service that's in new opportunities is critical to the person's needs. And that has to be submitted to the state. And there's a committee at the state level that does that approval. So it's a little bit more difficult, but that waiver is a very expensive waiver. So what we're trying to do with this tiered system is get more people services that they need while they need them. Prior to this tiered system, we waited 11 years, 12 years, 13, 14 years to get a waiver, and you get an offer. And then, most people just like, oh, we got the now waiver, got the now waiver. Well, some of those people really didn't need more than a ride to work. And this is a real expensive waiver that's earmarking those dollars for the maximum because they approve for the maximum. So when that's not used, that's wasted money that could go to somebody um, who could need it. And we did have people who unfortunately passed away on the list before they got services, and that's not right. So this is our new system, and so far it's been working pretty good. But let's go to the next slide and talk some more. So to apply for the developmental disabilities waiver, I had some people do this. They went in online and they filled out an application and sent it in. It doesn't quite work like that. You have to start with your human service authority or district. You're going to see on the next slide, there's a map. You're going to go to them, call them, and say, hey, I need an appointment for an eligibility meeting. Now, not everybody knows this, but if you have a hardship and cannot make it to the office, because some of them are very far away, you can ask that they come to you and meet with you in person at home. So you're going to ask for an eligibility meeting, and you get a statement of approval saying, yes, the individual meets the criteria. Then you do what's called a survey of urgency of need to see how urgently you need that waiver. And if you have urgent or emergency need, they're going to give you a waiver offer. If your needs are not for specifically the waiver services, if your needs are not urgent or emergency need, you will remain on the registry and you will continue to get that little sun survey. They will do that survey again periodically. But the thing I want you to remember about that survey is it is absolutely not meant to be a permanent score. So you could go 3 days and have some, God forbid, knock on wood, some tragic, you know, happening that changes the landscape of the care that you need for your child. You can call the Human Service District back again, tell them I've had a change of circumstances, and get that survey redone. Now, for the aging and adult disability community, you're going to call the Louisiana Options in Long-Term Care. They'll do a little screening, then they'll talk to you some about it. They do have a short waiting list, but it is absolutely not anything like they were experiencing before, or like we used to experience for those of you who've been around a while, like we used to experience when we didn't have our tiered system for developmental disability waivers. You're not going to wait 15 years. It's absolutely nothing like that. And of course, then the behavioral health waiver, you're going to contact Magellan of Louisiana directly at that number. That's how you apply. Let's go to the next slide. Now, this is the map, and this is a link to it. When you go to this link, you're going to see the map, but you're also going to see how you can choose to either click on a parish or a region, and it'll bring you directly to the Human Service District information for that region. It's also listed. You can scroll down and see that. It tells you how to contact with them. Our area, we have Florida parishes, Jefferson Parish Human Service Authority, Metropolitan for the greater New Orleans area, South Central Louisiana Human Service Authority. It's mostly river parishes and then bayous, and then Acadiana Human Service District, which is our Lafayette and Greater Lafayette area. MCAL is Imperial Calcasieu. That is our western parishes. Central Louisiana Human Service District in Central Louisiana. And the upper left and right, we have North Louisiana Human Service District and Northeast Louisiana Human Service Authority. So they all operate the same way. They all have the same structure. They all do the same things. They are responsible for the behavioral health services in your community and those behavioral health programs from the state. And they are also responsible for administering the developmental disability services in your region. So let's go to the next slide. So when should you apply? For regular Medicaid, apply now. Apply now. It's not going to hurt. If for a developmental disability waiver, you should apply at age 3. As you're rolling out of early steps at age 2 years, 6 months, they're supposed to transition you to that human service district and authority as well as your local school district. They can start doing that eligibility determination at 2.6 because it'll be done like, before they turn 3. And that process will get the child in the system, and then we'll see if they need a waiver at this time or possibly at a later date. Unless your child is hospitalized. If a child is hospitalized at any time, 0 to 3, or if they're older and don't have a waiver, if they're hospitalized 60 days or more, then they can get a disability waiver, developmental disability waiver, to be able to come out of the hospital. So the purpose of the waivers in a nutshell is to get people out of institutions, and hospital is an institution. So if it provides enough care for the family to be able to manage without being in a hospital, they can do that. So unfortunately, I'm finding that hospitals are not educated on that. And we have some, I was one of them. We were in the intense ICU, the NICU for 2 months, and then like another 2 weeks in pediatric intensive care after surgery. No one ever told us that I could have gotten a waiver. That would have saved us so much heartache and fear. Adult aging disabilities, that's after the age of 22 when the disability occurs. And they'll make those determinations about eligibility. Coordinated system of care, that's the behavioral health one, that's aged up to 19. Okay. Let's go to the next slide, please. Now, what else is out there? There's a good bit. So let's talk first about what's called Act 378 money, or it's also called Individual and Family Support Fund. The thing I want you to remember about this is you can ask for anything that your child needs. This is a request made through the local human service district. You're going to call them and say, hey, my child needs this. I want to make an Act 378 request or an individual and family support request. And they go through a process. Can take about a month, maybe a little longer if they need more information. You can ask for some kind of a specialized bed that might help them, or if it's not otherwise covered, you can ask for help with paying copays for certain things that aren't covered. You can ask for a weighted vest, a blanket. But the other thing is, and I want everybody that's listening today to hear this, because disaster and tragedy can strike at any time, unfortunately. You can have a house fire, flood, hurricane. If you are in any kind of a crisis situation, you can ask for crisis funding. So some of the things I've seen this fund do, I had a grandmother who had a grandchild, very disabled young lady, and they lost their home twice in 6 months. First to fire, they scraped enough together just to get a little, very inadequate apartment, and that apartment flooded after they moved in, like 3 months after they moved in. So they were homeless again. It had like 3 feet of water. She had to get out. They lost everything. So what we did was at the Human Service District in South Central is they were able to help grandmother with first month's rent and deposit on a new rental. The young lady who was in our developmental disability system, they were able to provide funding for grandmother to get a bed. She didn't have a specialized bed. She didn't need one, but to get a new bed, dresser, a few items of clothing to kind of get her started. And it was an absolute miracle. The joy that it brought this family, and I'll never forget that as long as I live. During the last Hurricane Ida, South Central, for people in their region, they helped out with when FEMA no longer paid for hotel, or for whatever reason a person wasn't eligible to get FEMA. Because I think if, like I say, someone someone's renting from you in your home, they're just renting a room. The house is eligible for the FEMA assistance, but like not that other renter. So they can help with paying for temporary housing, like hotel. And we had a couple of families that, FEMA ran out and the repairs were being done, but they weren't done to the point where the house was inhabitable for someone with autism. The young lady's son had autism. So they needed like a couple of more weeks before they could go into the home after construction. Um, and South Central was able to assist with that. I've also seen it used for a very rural family who their access to Medicaid transportation was practically zero because of where they were. That just nobody would come out and get them. Mom had one vehicle, very medically involved child, needs to get him back and forth to appointments, and they were able to help with a car repair that she wasn't able to afford. So Act 378 is a very important program. I encourage anybody that has needs to definitely talk with your Human Service District or Authority if there's unmet needs and see if this program can help. It is based on how much money is there at the time. The money is replenished by the state legislature every July 1st, and it is all state money. It is not federal in any way. So it doesn't have like the same kinds of criteria that federal would, and they can pay for things that maybe federal can't. So it's definitely beneficial. There's also the Flexible Family Fund, and this program is for families with a child that has the most severe and profound disabilities. It is a stipend of $258 a month, and that may not sound like a lot, but that 258 can really do some good when you're really needing help, especially with rents as high as they are now. I did have a family years ago that they relied on that to be able to make rent. Mom needed to do that. So it's 258, has the children that have most severe and profound disabilities. There is a waiting list. It is completely separate from anything to do with the waiver. You have to apply to get on that waiting list. Now, my caveat on this one is I want everybody to know if you apply and you get on the waiting list, be sure to make sure that you make a note of when you sent that application in, because what will happen is the next year you have to re-up your eligibility to be on that list. And if you don't get the application back in time, they will drop you off the list. So if you kind of say, hey, it's whatever, June or whatever, and haven't seen that application come in, call them and tell them to send it to you again, or go run and pick it up if you're able to, just to be sure that you get it in on time. I've had a lot of people that were bumped off that list. We're going to talk a little bit more on the next slide about Social Security, Traumatic Head Injury, Head and Spinal Cord Injury Trust Fund, the Councils on Aging, Medicare, and SNAP. So let's go to the next slide. Yeah, we can skip this one because I already did this. I'll just said it without going to. Let's go to the next slide. There we go. So for Social Security disability, you can apply online, on the phone, or in person. I recommend doing it by phone. It's easy, or doing it online. If you do go to your Social Security office in person, a parent gave me this tip. Go at 3 o'clock in the afternoon because they've already gotten rid of most of the people there. If you go on a Monday morning or a Friday morning, you're going to be waiting a lot because people are trying to get in and they all conglomerate early in the morning to try to be the first ones in there and get out earlier. If you apply for minor children with disabilities, if you have low income, but I will tell you, they're going to look at your income first, not the disability. And if you get a really quick letter after you applied, it means you didn't meet the income criteria. And there's no debating that. Okay. You apply, you will have to either apply then when the child turns 18, or if you did get a check for them when they were younger, when they turn 18, they're going to have to re, I don't know if it's a full reapplication, but they're going to have to get recertified because you're going to have a whole new set of records. They want to be sure it's a different criteria after they turn 18. That's the whole crux of it. Um, Yeah, that's the last point. So I already mentioned that. Let's go to the next slide. There we go. So traumatic head and spinal cord injury trust fund program. There's not an age limit on this. So you definitely, if you have a child that has this type of disability, you want to call them and have a talk with them. But in general, they can provide over and above whatever you may have from insurance, Medicaid, whatever, um, evaluations, acute care, rehab, any kind of medications and supplies that aren't being covered, personal care, technology, equipment. They can do modifications to the home, to the vehicle. They can pay for repairs, and they can help with transportation for non-emergency medical care, which that is a different system. It is not the same system that you have with Medicaid, because I know a lot of people have trouble with that. So you definitely want to take a look at that. The application packet link at the top also has like a fact sheet in it. You can learn more information, and of course, you can call the number there. This is run through the Office of Aging and Adult Services as well, but it's anyone who has that traumatic brain injury or spinal cord injury. Can we go to the next slide? Now, Medicare. So Medicare, a lot of people have questions about it because it's very confusing. Medicaid is what gives you that long-term care service. Medicare, we generally associate with older people, elderly, turning 65, you're eligible for Medicare. It could be offered to you though if you are based on age. So like if a parent is disabled, um, and the parent's been getting a disability check and the child's disabled and getting a disability check because the parent is disabled, because it's all being pulled off the parent's record. After they've had that for it's 24 months after the first check. First check takes 5 months, no matter whether you're approved or not. Then another 25 months, so 30 in total. Then you can get a Medicare offer. And it'll just come in the mail. But if you don't get it and you think you should, you can call Social Security. If the parent dies and a child is disabled, and they've been getting that disability check for that 30-month period, they can be offered Medicare. You can be dual eligible for both Medicaid and Medicare, and you can even have private insurance with that. Now, if you have Medicaid and Medicare, Medicare becomes the primary, Medicaid is the secondary. And what people get most confused on when their kids become adults and they get the Medicare card in the mail, the little red, white, and blue card, the prescriptions. The prescriptions confuse everybody. So what'll happen is most of the time, if you have both, Medicaid will say, hey, you have Medicare now. They have drug coverage. We're not going to pay for your drugs, but we'll pay for your plan. So we're going to enroll you in a prescription plan, and then you go change it if you want to. And they pay for the prescription plan. So that gets really confusing, because then there'll be times when, the pharmacy is just like, we don't know what's going on. You have to pay for it. So if Medicaid's not covering it, well, Medicaid's not, because they're paying the premium. It's supposed to be going run through Medicare, and your Medicare drug plan. And you may not even know. They're supposed to send you a letter that says your drug plan in it. The drug plan is supposed to send you cards. I can tell you for us, we didn't get that. So all of a sudden I was getting charged. And so what I found out was, if you're in that situation, they enrolled you in something that you're getting charged for a prescription, he really can't afford it, you have the option to change that plan. And there is support out there to help with that. You can change that plan. You can change it without any cost to you. You can change it at any time that your prescription plan's not working for you. All right, let's go to the next slide. Now, food stamps. I get a lot of questions about this too. You can apply online. You have to apply online. If you try to call them, it can be daunting. I don't know what the hint or the trick is to help people with that. If I knew, I think I'd probably be rich, because it's difficult to get in touch with them. And if you have an appointment or if you've asked for somebody to call you back, be sure you answer every weird phone call and check your spam folder for messages and that type of thing. You can apply at 18. A child can apply at 18 or adult. But at 18, they're still going to count the parental income, the household income. Once you hit 22, though, that family income is not counted. So I have a lot of families that say, hey, we're going to wait to 22 to apply because I know good and darn well he's not going to qualify with all of our family income. But with his income, all he gets is Social Security. So he'll qualify for something with food stamps. So that's kind of how that works. Let's go to the next slide. I think we're getting to the end. Yes.